At present, the world has to encounter the problems of climate change, environmental degradation, disasters, and epidemics of emerging and re-emerging diseases, which are common health problems of many countries. For Thailand, the guidelines for responding to both groups of diseases affecting people's health have been developed, including the systems for disease surveillance, prevention, treatment, and control under the One Health concept. For example, working collaboratively in a multidisciplinary manner among officials in the human and animal health, as well as environmental sectors. Moreover, actions are ongoing regarding the development of capacity and preparedness of the management system, as well as personnel and knowledge management for efficiently preventing and controlling communicable or infectious diseases, according to the internationally recognized standards. Collaboration for disease surveillance in poultry industry, a case study of Chachoengsao province. Chachoengsao, a small province in eastern Thailand, is a province of agriculture, with more industries currently coming in to change the lifestyles of its residents. Back in 2003, when avian influenza or avian flu was the health threat that affected Thailand's livestock farming as well as public health, resulting in poultry deaths and human infections. Here is Ban Pho Hospital, which used to be the operation or coordinating center for responding to the avian flu outbreak that affected the health of local residents. Dr. Kasiwat Si Pradit, director of Ban Pho Hospital, said, "Our district has a lot of industries or factories and poultry farms. We have to focus on disease surveillance for farm workers and other people who have contacted any infected poultry and get prepared to give medical treatment to avian flu patients. We have revised the action plan to deal with suspected cases, the contacts and the patients with avian flu, based on the one-stop service principle. A special space has been arranged for the patients so that they will not be any contact with other people and to prevent the spread of avian flu viruses." Besides the impact on human health, in the economic system in Chachoengsao, the poultry farming areas were also affected. Wirod Prayun Wiwat, director of the Livestock Office of Chachoengsao, said that during that period of time, there were avian flu outbreaks all over Asia, including Thailand. In Chachoengsao, the outbreak was detected in poultry, especially chickens. A lot of them had died. At that time, the Livestock Development Department undertook measures to contain the outbreak within a certain area without using an avian flu vaccine. One of such measures was the culling of chickens, which had an impact on a large number of chicken and poultry farmers. During that crisis, all sectors, including the provincial administration, public health, livestock department, as well as the popular sector, had to collaborate in setting up a provincial war room to identify measures for controlling the outbreak and to assign certain tasks to certain agencies. With regard to the public health sector, urgent actions were carried out to control the outbreak and treat infected patients. The strategic plan was revised to facilitate case investigation and disease containment, to provide public education about disease prevention at all levels, including the people, schools, healthcare facilities, business places, and relevant industries, and to undertake outbreak response drills at various levels. Chan Lekha Kunlawanit, the Ban Pho District Health Officer, said, "We gave importance to working systematically from planning, particularly for at-risk localities, before, during, and after the outbreak. And then responsible persons were assigned to do important tasks, such as news reporting, public relations, disease control, and workforce management. All sectors had to be aware of their own duties and work with close relationships while resolving the overall problem through multi-sectoral collaboration, as it would rather be difficult to finish the work by the public health sector alone." Concerning livestock officials, they had to work in parallel with health officials on disease surveillance, investigation and control in poultry production localities, from the village up to the factory level, involving giving knowledge to farmers, business operators, and the general public. Wirod Prayun Viwat, Director of the Livestock Office of Chachoengsao Province, said that the Livestock Development Department of the Ministry of Agriculture and Cooperatives and the Ministry of Public Health had to work collaboratively all the time. If any house was expected of having avian flu-infected poultry, the livestock official would get into the house for disease investigation and control, and then notify the relevant health official to do the human case investigation, especially with poultry farm workers. On the contrary, if the health official found a person suspected of contracting avian flu and having been in close contact with poultry raising, the livestock official would be notified to do animal case investigation. Most of the time, they would do the field work together. Most importantly, the key factor for containing avian flu so that the outbreak will not further spread is working collaboratively among health and livestock officials after being notified of the incident. Doing a joint case investigation in the field of both agencies' officials is the picture of livestock officials taking care of animal health, giving advice to poultry farmers, while health officials doing human case investigation and giving advice on healthcare to relevant farmers, and the officials of both agencies sharing the information with each other for effective cooperation. Besides working with small farms, the inspection and communication about avian flu in poultry factories are other duties of both agencies in Chachoengsao Province, which is an important area of food production and processing, especially involving poultry in Thailand. Clarifying certain issues, creating a good understanding and conducting inspections in the normal situation and during the avian flu outbreak are important duties of both agencies to work together with factory operators, because the disease control measures chiefly focus on the workers and relevant food products that affect both domestic consumers and exports. Narit Punya Likit, Managing Director of Duck King Company Limited, said, "When the last avian flu outbreak reached our factory, although we already had the production control standards, we were also affected as we didn't know about the disease characteristics and severity. The consumers did not know about that either, so they didn't dare eat poultry products. As a result, the business also faced a problem. But after the health and livestock officials had clarified that it was safe to eat inspected poultry from the production source with a standardized process, the people turned back to eating poultry again. Farmers and production farms focused on improving their production methods according to the established standards. Since then, the number of certified production sources or factories has increased considerably. The collaborative work of the health and livestock sectors is good, and the culling of all poultry is not required. The outbreak could be controlled with the good cooperation of poultry producers, with better operating guidelines and better understanding of each other. Based on the lessons learned from the last avian flu outbreak or crisis, many farms have adopted the good manufacturing practices and disease control measures because the consumers will be confident in selecting and consuming only the poultry from the farms with standardized production process. The lessons learned from the avian flu outbreak in Chachoengsao has reflected the fact that multi-sectoral collaboration in disease control involving the people, relevant health and livestock agencies, provincial administration agencies, and relevant private businesses is the key to successfully ending the outbreak and creating confidence among consumers to turn back to eating poultry products and eggs again. And then the operators and farmers will get more revenues from animal raising. Since then, there have been no reports on avian flu outbreaks.